Thanks everyone for coming to this webinar on adolescent sleep and mental health. My name is Samantha and I work with Dr. Eliza Werner-Seidler at the Black Dog Institute. Dr. Eliza is the director of the sleep team. I'd like to thank the Randwick Council for giving me the opportunity to present today. I'm excited to be talking about some really important themes in the lives of young people and their caregivers. And it's a great time to do it because this week is Sleep Awareness Week, which raises awareness about the importance of sleep for improving people's lives. Just a little bit about what I'll be talking about today. So first, I'll talk about the extent to which sleep is a problem among young people, a little bit about why sleep is important, some reasons that could be creating sleep disturbance among young people, some simple tips and strategies that can be used to help young people with their sleep, and then I'll be talking about our ongoing Dream On study, which is looking at the effectiveness of a smartphone intervention to help people with this, young people with their sleep problems, and just some simple tips on how to register for this study. So adolescent sleep problems are incredibly common, often referred to as an epidemic among youth. And up to 40% of young people experience sleep problems during high school. So sleep problems can include a range of issues like difficulty falling asleep and staying asleep, waking up too early, poor quality sleep, and daytime fatigue. So getting a good sleep is challenging at the best of times, let alone when in the midst of a global pandemic. So it's understandable if you or your teens are feeling more worried or anxious than usual. So a recent Black Dog Institute survey of 5,000 Australians found that over 75% of people reported declines in their mental health since the outbreak of COVID-19. Young people have experienced huge changes during this time to their schooling and socializing and tech use, the time in their bedroom. So it's important to consider all these changes during this conversation about sleep and mental health. In terms of how much sleep young people actually need, international guidelines suggest between 9 and 11 hours for 12 to 14-year-olds, between 8 and 10 hours for 14 to 17-year-olds, and 7 to 9 hours for individuals 18 and above. But it's important to note that these guidelines do vary from individual to individual, so some people do better with less sleep compared to others. So we know that sleep's important for young people, and we know that young people struggle with their sleep. So let's talk a little bit about that. Okay, so sleep restores our body and our minds. A lack of good sleep can feel like a form of torture. Young people need a lot of sleep for their physical health. So we need sleep for muscle growth and tissue repair. So without quality sleep, it can compromise young people's immunity and prevent them from living a full and active lifestyle. Sleep is really important for our ability to pay attention and learn and remember things about the world. So it goes without saying that sleep's really important for schooling life. Young people are exposed to a constant influx of new information. So they need good quality sleep to be able to process and store this information into long-term memory. So young people need sleep to learn about the world. So sleep and mental health problems are quite tightly linked. Sleep disturbance can lead to greater negative moods and can disrupt young people's ability to regulate their emotions and stay positive. And if sleep problems persist, it can manifest into more serious mental health conditions. Research has shown that sleep-disturbed young people are more severely depressed and are more likely to have anxiety when compared to non-sleep-disturbed young people. And over 50% of young people with insomnia also experience depression. And so young people are already at risk of depression, so the occurrence of depression more than doubles during the high school transition. And sleep is often the first thing young people notice when they might be struggling mentally. So what are some of the reasons why this is happening? Well, firstly, adolescents have a different internal body clock to kids and adults. So their brains work on later schedules producing melatonin, which is the hormone that makes us feel sleepy, later in the night compared to kids and adults. Adolescents are going through major developmental and social change, a lot of figuring things out, relationships, schoolwork, thinking about the future. So this kind of stress and their emotional troubles can be impacting their sleep. Also worrying about the fact that they can't sleep is something that prevents sleep and exacerbates the issues. So a lot of people might be thinking about the impact that social media and device use has had on sleep quality. So rates of sleep disorders haven't changed, but sleep disturbance has increased. So lack of quality sleep and not enough sleep. So it's not the phones, the devices themselves, but it's that are causing the problem. It's what people are doing with them, what young people are using their devices for. In terms of, it's been suggested that just using a screen, just the light from the device can actually delay circadian rhythms and delay sleep. This research is inconclusive as of yet. But in terms of social media, it does increase the alertness of young people. So using Instagram before bed and being transported to a world of multiple interactions that are ongoing without an endpoint can keep young people alert and delay sleep onset. So yes, these factors can delay the sleep-wake cycle, which can then interfere with daily activities. So the good news is that there are some simple strategies that can help. So exposure to natural light in the morning, that can help young people become alert. It can reduce the level of melatonin in the brain so that they start feeling more awake and ready for the day. Regular wake up times are really important. So deviations of even 1 or 2 hours can kind of throw off circadian rhythms. So a weekend sleep in can kind of throw off this regular cycle. So it's important to stick to regular wake up times. Avoiding naps is important because naps can make the problem of late bedtimes even worse, which can then make it harder for young people to wake up. So supporting time management and making sure young people aren't up doing all-nighters is really important. If school starts 8:30 or any earlier than that, that's pretty early for young people for their circadian rhythms. So if they have any extracurricular activities planned before school, it could be worthwhile to reconsider these activities being held after school. Distance from phone before bed. So that's kind of intuitive, just to reduce alertness and prepare the mind and the body for bedtime. Avoiding caffeine, replacing with some herbal tea or some water. And a really important one is not to enforce a bedtime. That can leave young people feeling quite frustrated if they can't fall asleep when they're supposed to. So instead, it would be good to encourage a wind down routine that they can do before bed, like reading or having a hot shower. Another important one is to associate the bedroom with sleep only. So not for watching videos or chatting to friends. And that can build the young person's association between the bedroom and sleep and create a calming environment. Also, to try to understand, I guess, that they do have different sleep-wake patterns, falling asleep later. Sometimes they may want to go to sleep and just may not be tired yet. So I think that understanding can really help. And exploring what the exact issue is. So what are they struggling with? Is it falling asleep? Is it waking up too early? And really asking what kinds of activities are being impacted in your lives by this and working through it that way. So implementing some of these strategies might be affected by COVID, especially distance from phone, associating the bedroom with sleep. A lot of activities have been merged with doing a lot of things from home. So if this is the case, it might be even more important to start implementing some of the other strategies. Okay, so treatments for sleep problems. The gold standard treatment for insomnia is cognitive behavioral therapy for insomnia. And this therapy has been shown to help people fall asleep easier, spend more time asleep, and spend less time awake in the night. And it's been shown that these findings have been maintained for up to 3 years. So in order to make CBTI more available and accessible for the whole population, research has looked into online delivery. So you can kind of think of it as like a virtual therapy and can involve setting sleep goals, like submitting sleep diary data, so time of waking up, time of going to sleep. Oh, there was a pop-up there, sorry. And reviewing one's sleep. So digitally delivered CBTI has been found to be a viable alternative to face-to-face CBTI, and it's improved the amount of time it takes people to fall asleep, spending less time awake, and having a longer sleep. And accumulating evidence suggests that digital CBTI can improve sleep and mental health outcomes for both young people and adults. So why would a digital method be better to reach adolescents? Well, they prefer it. So young people tend to be reluctant to seek face-to-face support. It's easy for them to access, so it's convenient, and that way we're able to put evidence-based tools into the hands of young people whenever and wherever they are. And we're supporting the now generation by tapping into their channel of choice, which is their smartphones. So a couple of years ago, Dr. Elisa Werner-Seidler and her team reviewed the literature and found that there were no commercially available CBTI online programs or tools for young people. So they decided to develop one, which is the Sleep Ninja. So we'll be talking about the Sleep Ninja for a little while now. So the first thing that was done was the sleep team heard from young people themselves. So asked them about the online programs they use, their sleep habits, well-being, their tech use, and their opinions on graphics on apps, reminders, notifications, other features like that. Developed an app and ran a pilot study to test this app on how acceptable and feasible it would be as an intervention, as well as to look at its effects on improving sleep and mental health. So 50 young people aged between 12 and 16 with at least mild sleep difficulties were the participants of the study. And it was found that young people like it and they use it. So they found the app appealing, they were optimistic about using it and about its how useful it would be, and it had good completion rates. In terms of sleep and mental health, as you can see, there were improvements on these 4 variables. So using the app reduced insomnia, sleep disturbance, depression, and anxiety. So after these promising preliminary effects, we're now running a larger study called the Dream-On study to compare the Sleep Ninja intervention to a waitlist control group. So it's important to ensure that to rule out any other contributing factors to these effects that were observed in the pilot study. So which is why it's important to compare a Sleep Ninja intervention to a control group. So the primary aims of the study are to look at whether the Sleep Ninja app intervention reduces insomnia and depressive symptoms relative to a control group. And secondary aim is to look at the effects of the Sleep Ninja app on anxiety symptoms and depression onset, as well as its effects on other measures like psychological well-being, life satisfaction, and sleep variables. So the Sleep Ninja is based on cognitive behavior therapy principles, and it's for young people that have mild to moderate levels of sleep difficulty, so that we can get in there early and help the problem before it gets worse. So young people had a huge role in creating the tool, and the result is a fully automated app where young people train with a ninja who acts as a sleep coach and teaches young people how to establish and maintain optimal sleep habits. Importantly, the app is designed for use during the day, not at bedtime. So the Sleep Ninja guides young people on why it's important to keep their friends away before bed. So the Sleep Ninja app is structured like a game. It's designed to be fun and interactive, where users gain belts as they progress through training, and they eventually become a black belt in sleep. So to progress through the training sessions or the levels in the game, the young person tracks their sleep at least 3 times a week and then completes their training session. Each night they get reminded of their bedtime based on their wake-up time. And an hour before bedtime, the Sleep Ninja guides the young person through a wind-down routine, which they created initially based on some of the Sleep Ninja's suggestions for how to wind down. The young person also receives encouraging reminders of their progress, just to keep the motivation going. So the Sleep Ninja character is a fourth choice chat box that young people communicate with. It provides personalized responses to the user's questions or responses that they select from a drop-down list. And it runs offline, so that reduces the barrier of needing internet connection all the time or phone data. And after the 6 levels of the Sleep Ninja completed, the young person is awarded a black belt in sleep. So I'll just run you through the 6 training sessions very briefly that are involved in the Sleep Ninja, just cover the basic concepts and what young people will learn while using during the intervention. The first lesson is sleep scheduling. So young people learn about the basic scientific concepts of sleep. So psychoeducation, learn about circadian rhythms, the importance of regular sleep-wake times. Lesson 2 is into the bedroom, teaching young people about sleep hygiene strategies, such as the importance of using the bed only for sleep. And if you have a look here at this image, it asks young people to point out the things that may not belong in the bedroom, like the guitar and the food and just other things that aren't associated with sleep. Lesson 3, from day to night, teaches young people strategies that can be used during the day to assist with sleeping well at night, like avoiding caffeine and avoiding naps. Lesson 4 is about teaches young people cognitive strategies to be able to deal with some of the unhelpful thoughts and the rumination they might have that can disrupt their sleep. Lesson 5, bouncing back, teaches young people how to get back on track after they have a late night or a sleep in, and these are inevitable. And lesson 6 is the final challenge, so testing overall knowledge and understanding of the strategies that the young person has learnt, and how to identify for high-risk future scenarios, how to manage these. And the more section contains a meditation recording, which young people can access to practice their relaxation, such as controlled breathing. And also includes some further information about sleep, information for parents, so frequently asked questions, and importantly, has a Get Help Now feature, which links the young person to the kids' helpline number in case they need more support. So our Dream On study is a 5-month trial where young people complete questionnaires and complete sleep diaries at 3 time points. There's the baseline, which is the first time point that they complete the questionnaires and sleep diaries. Then there's the post-intervention, which is 6 weeks after, and then a follow-up, which is 3 months after that. So the young person will either get allocated to receive the Sleep Ninja or to a waitlist control group, and that group of young people will receive the intervention after 5 months. But during those 6 weeks, they will receive a series of sleep tips, such as how to create a wind-down routine, and important things like avoid your phone, keep your phone outside, don't check your phone in the night, things like that. So far, we have over 200 people in the trial, and it would be great to have some more young people join the trial, and to get this tool out to our young people. We're also reimbursing young people for the work that they're going to put into the study. So they receive a $10 voucher for each assessment point that they complete. And young people are eligible to participate if they're between 12 and 16, speak and read English fluently, own a smartphone so they're able to download the Sleep Ninja app, have internet access and an email address, and have sleep difficulties that impact their functioning, and they must have consent from a parent or caregiver. So in terms of registering, these slides will be available on the Randwick Council website. So this is the link to sign up for the study, and it will take you to this expression of interest page. And after filling out the expression of interest, you'll be provided with an email with further instructions. Or you could just contact us. I will be behind the email and I will respond to you very quickly and sign you up for the study. Importantly, the Sleep Ninja is not designed to replace treatment. So if young people are in care for their sleep, then they should continue to do so while participating in the study. Just some other tools and useful links. So for people aged 17 years and above, Sleepio is another digital tool they can use for their sleep. Just some links for information about healthy sleep, and also if a sleeping disorder is suspected, recommended to see a GP for referral to a mental health specialist, sleep specialist. I'd like to thank the team at the Black Dog Institute, so Helen, Elisa, Sophie and Lara, and our funders for allowing all this research to happen. So if there are any questions.
Hi, Sam. Thank you so much for that. We do only have one question at the moment, so if everyone else has any questions in the interim, please feel free to pop them in the chat. But the first question we have is, how do you measure quality of sleep?
Measuring quality of sleep?
Yeah.
Well, in terms of how we gauged young people's quality of sleep throughout the study, is that the question?
Possibly. That he's just asked, how do you measure quality of sleep? So I guess however you can answer that.
Yeah. So self-report measures we use. So we have like a variety of sleep questionnaires that ask people about their sleep. So time of waking up, the time spent in bed versus the time spent in bed actually sleeping. So that's a measure of sleep efficiency. So the idea would be just to maximize your time spent in bed actually sleeping. Other sleep variables that would be measured to look at sleep quality would be the amount of nighttime awakenings, the total amount of time kept awake at night. So all of these variables kind of come together as a measure of sleep quality.
Perfect. Another one has come up as well. Are young people with a disability able to participate in the study, such as ASD or Asperger's?
Yes. Yes, so we don't have any exclusion criteria.
Wonderful. Mm-hmm. And that's all the questions that we seem to have at the moment.
Hey, great.
If anyone does have any other questions or you'd prefer to ask Samantha a question directly, please do feel free to reach out to Samantha. Sam, did you have your contact back there that we could?
I do, yeah. So it's just on the slides, 2 slides before this one. It's the sleep@blackdog.org.au. So that's the one you can get me on. And I'll be happy to answer as best as I can any questions that anyone might have.
Wonderful.
Yeah.
Okay, if no one else has any other questions, you'll get an early mark. But otherwise, thank you so much, Samantha, for that and for the study that you continue to do as well.
Thank you, Grace.